My name's Melinda Arias. I'm the Dean of Nursing for Carrington College Tucson campus. I have been a registered nurse for almost 14 years. My background is in women's health, so I worked labor and delivery, postpartum. I started in nursing education about 7 years ago. I obtained my master's in nursing education and started teaching full-time. I am currently in a psychiatric mental health nurse practitioner program. I enjoy teaching and learning myself, and so I hope to continue that, working in the education world and then also working in the clinic, as there's a big need in our community. The best thing about being a registered nurse is that you make an impact on every single patient that you work with. I have to say, in my experience, I've taken care of patients, and years down the road, I run into the patients and they come up to me thanking me for taking care of them while they were in the hospital or taking care of their family member. So knowing that you make that positive impact on the person that you work with, whether it's a one-time occurrence or multiple time, it's great knowing that you're touching people's lives. There's a lot of growth with nursing specifically. There is opportunities for professional development, professional growth. The great thing with nursing is you can start in a specific area, and then years down the road, you can go into a different specialty. And for example, for myself, starting in women's health, I've been able to expand to nursing education, expanding to mental health nursing career as well. So there's many opportunities in nursing to go different pathways. So at Carrington College and our nursing program, we work very closely with the students and preparing them to work as practicing safe nurses when they complete the nursing program. This includes didactic, so learning the knowledge base, also hands-on experience in the skills lab, practicing skill sets that they're going to utilize in the clinical setting. Students also attend clinical rotations in their nursing courses, so they're able to apply what they're learning in the didactic class as well as the skills lab and apply that to real patient care. We also have simulations that are centered for student learning, where we can simulate patient scenarios, and students can go in and practice on a simulated mannequin and practice those scenarios that will help prepare them as well when they go to the clinical setting. One of the things that I love about Carrington College is that we are very student-focused and centered. So we have our nursing faculty working one-on-one with students. Our cohorts are smaller, so where we can have that one-on-one tutoring, one-on-one additional office hours, working hands-on as a collaborative group with the nursing faculty and students, as well in the clinical settings, making sure that our instructors are there with the students working side by side with the nurses in the clinical sites. 3 of our graduates were hired at one of our clinical sites, and so now our current nursing students that are attending that clinical site get to work with our Carrington graduates from August. So it's great to see that students we worked with are now practicing as nurses and teaching our current students. When I was a sophomore in high school, I was 15 years old, and I had a severe health concern that happened, where I ended up in the hospital for a month and a half, and the care I was provided by the nursing staff, nurses, physicians, techs, physical therapists, they really saved my life. And in that moment, I realized that I wanted to give back. I wanted to give back to others and care for others the way that I was cared for. And so from that moment, I knew nursing was my career path, and I'm so thankful that occurred and I was able to choose this career path and have continued to grow and professionally develop and teach other future nurses to make the same impact for others that they encounter.